Hello, my name is Christina Matherly, and I'm doing my case study on type 2 diabetes. Okay, TC is a 37-year-old African American female who has been admitted to the behavioral surgical unit after experiencing a diabetic ketoacidosis condition, which has now been resolved. TC is unemployed and is also homeless. She does not have children and is single. She has a history of schizophrenia and is conserved by her mother. She has medical insurance, and upon admission, she stated that she has type 2 diabetes and sometimes forgets to use her insulin, and that her mother doesn't want her living with her, so that's pretty much why she's homeless. She also stated that she likes living by herself and lives on the streets nearby the hospital. The patient's mother has provided conservatorship paperwork and signed forms to allow patient to be placed in a lockdown facility upon discharge. TC was diagnosed 3 years ago with schizophrenia and diabetes mellitus about 4 years ago and has been hospitalized for both conditions. Her mental status greatly affects her compliance with medications. At times, she has refused medical treatment until her most recent incident where she's been hospitalized due to a chronic exacerbation of hyperglycemia. Due to her non-compliance with medication, she has remained in the hospital for a total of 96 days and is conserved until the patient can comply with her medications, which is her psychiatric medications and also her insulin. She has a court order to take psychiatric medications due to a lack of mental capacity. However, she is allowed to refuse all non-psychiatric medications. Little is known about her previous history with illness prior to any records of hospital admissions. For schizophrenia, she's prescribed Seroquel 300 milligrams twice a day. For agitation, she gets Zyprexa. If she refuses any of her oral medications, she is to have olanzapine 5 milligrams intramuscular injection. For safety purposes, the hospital does use Code Gold, which is used for assistance if she becomes combative and puts staff or patient at risk. She's also on her home regimen. She's also on Lantus 20 and Lispro 7. Her blood sugar is usually elevated after snacks, and she has a continuous 23 units of Lispro. She is also on the patient is also on a consistent carb diet. The primary nursing diagnosis is deficient knowledge related to unfamiliarity with the cause, prevention, and treatment of DKA. The desired outcome for this patient is that within the 24-hour period before hospital discharge, the patient verbalizes understanding of the cause, prevention, and treatment of DKA. The primary nursing intervention for this patient is to teach the importance of receiving prompt treatment if the following indications occur: dizziness, impaired mentation, irritability, pallor, tremors, polyuria, polydipsia, polyphagia, or increasingly dry and flushed skin. These are indicators for both hyperglycemia and hypoglycemia. Okay, so clinical judgment and self-care capacity. She lacks the knowledge about her chronic illness. She's unwilling to take medications or follow a diet. And she has a second diagnosis that affects her compliance, which is schizophrenia. TC is alert and oriented herself in place, and like I said, she lacks the mental capacity to care for herself and also lacks knowledge in her chronic illness with a history of non-compliance to the treatment. While living alone and homeless, she was inconsistent with proper medication regimen and diet. The patient would also not attend regular doctor appointments and would not pick up prescribed medications from the pharmacy. TC will need constant redirection and supervision with administering medication. She'll also need to be educated by a healthcare professional on her current health situation, how to maintain her compliance. She'll need to understand the signs and symptoms of hyperglycemia and hypoglycemia, as well as a proper diet. Education will include the importance of adherence to medication and proper nutrition. Managing her diabetes will be maintained through hospital staff and a dietitian who will meet with TC to discuss meals while she's in the hospital. She'll also need education while she is discharged to her facility and continuous education. When TC complies with her psychiatric medications to treat her schizophrenia, she is more capable of complying with her diabetic medications. She denies having any psychiatric or medical conditions and does not feel the need to take medications. She does need constant redirection and instruction to adhere to the treatment. Some days she'll comply, and then other days she just feels like she doesn't need the medication. Per a recent hospital stay, she has not been that compliant with her medications at first, and she has refused during the beginning of her stay. Priority patient issues for discharge planning. Well, priority is finding a placement at a lockdown nursing skilled facility that'll accept her. She needs to comply with medications and comply with her diet. The priority patient issues upon discharge is ensuring that TC will comply with her medications, and she also needs to find this facility to accept her. She needs to be able to comply with her medications and also have good behavior upon discharge. If there's any restraints applied for violence to others, she'll need to be a month free with good behavior for the facility to accept her. She is REISed, which means she has a court order to take all psychiatric medications. However, she is allowed to refuse other medications and care, which is why teaching is so important for her to understand why she needs to take her insulin. We cannot make her take it. She has the right to refuse. Teaching her to care for herself has been the most challenging because she does not think she needs to worry about her diabetes, and she thinks, in her words, she thinks her body is fine without insulin. The goal for her is to educate her on why she needs to take insulin and to eat a proper diet. Clinical judgment about where a patient can be discharged. Okay, she lacks the capacity to live alone. She was homeless prior to hospitalization. She has the secondary diagnosis of schizophrenia, and she has a lack of support. Her mother is, she will sign the conservatorship to allow her to be placed in a facility, but she doesn't want to take care of her in her home. So TC's mother is her conservator. She has given documentation of conservatorship to the hospital and has given the okay to place her in the lockdown facility. The mother doesn't visit frequently, and her mother and as well as the hospital thinks that the most appropriate home would be a lockdown facility where TC will be conserved and will be provided with medical and psychiatric care, and also she will be safe. The priority nursing care management strategy at the patient level and system level. Well, at the patient level is patient education. Educating her is important for her to comply with her insulin. She will also need to have medication compliance and also compliant with a diet. At the system level, she needs patient safety. That's why she will be in a lockdown facility. And she also needs a follow-up with psychiatric and medical consults. She will also need to know about the consequences of not adhering to taking her insulin, which can result in diabetic neuropathy and loss of her vision, which are the long-term effects. One strategy would be to encourage her to adhere to her consistent carb diet so that she can result in taking less insulin, which she does not like to take. So that's something that has worked. We've, tried to find things that she likes to eat that are within her diet so she doesn't have to keep on taking more insulin to correct the blood sugar levels. She will also need at the system level to have consistent psychiatric and also medical consults to help with her diabetes management. And at the facility, she will be at that lockdown facility for safety for herself. Okay, intervention for the patient level nursing care management strategy is glucose monitoring, recognizing the signs and symptoms of hyperglycemia and hypoglycemia in diet. TC will need to be able to manage her diabetes as well as comply with plans of care upon discharge. The interventions for TC would include involving the mother in her plan of care for discharge so that she can encourage her compliance. Her mother is her conservator and is responsible for her health decisions and has recently been more involved in her plan of care. TC has been working with a dietitian to educate her on helping her eat a consistent carbohydrate diet, which will help control her glucose level. TC has also been educated on how to test her glucose level and understand how to recognize the signs and symptoms of hyperglycemia and hypoglycemia. Knowing the signs and symptoms will help TC be better able to prevent symptoms early on before a chronic exacerbation occurs. Okay, interventions for the system level strategy. She'll need a counseling follow-up, she'll need safety, and she'll need home health visits to provide diabetes education at the facility that she's at. TC has been given education upon discharge to help her manage her diabetes and will be provided with regular home health checks from a nurse that will be sent to her lockdown live-in facility. This will ensure that TC can continue with diabetes education so that she could comply with care. Counseling follow-ups have been assigned as well as monthly psychiatric consults to ensure that her psychiatric medications are effective. The lockdown facility that she has been discharged to will ensure her safety as well as a home where she can continue with her plan of care. Utilization review. She will need, prior to discharge, we need to ensure that we'll have all the proper documentation from the psychiatrist, her medical physician, counselors, education follow-ups, and her legal conservator documents that allows her to be placed in the lockdown facility. The continuity of care needs to be supporting from discharge to her new placement. She'll also need to have regular education follow-ups to ensure that she is following her health care plans. So upon discharge, we need to make sure that everything that we've been working on as far as education and her regular medications are followed through at her new placement in home. Quality and safety issues. She needs to comply with care to avoid readmission to the hospital. Many factors may lead to hospital readmission, such as poor quality care or a gap in the transition between different providers and care settings. Readmissions may also occur if the patient are discharged from the hospitals prematurely, or if they are discharged to inappropriate settings, or if they do not receive adequate information or resources to aid in recovery. TC can help avoid readmission by making sure that she understands her plan of care before she is discharged from the hospital. She will also need to be sure to follow up on care once she leaves the hospital. TC is capable of performing basic ADLs such as eating and bathing. However, due to her lack of mental capacity, she needs redirection and reminders to use the toilet. The facility will need to be aware of this so she can get proper direction. TC will also need to take her insulin and monitor her diet in order to avoid the effects of hypoglycemia and hyperglycemia. She'll have the same psychiatrist, so she'll not have to worry about a change in her psychiatric medication or plan of care. The current medication that she's on for her diabetes will be kept the same unless her new physician decides to change it to adjust her blood sugar levels. Nursing care management effectiveness at the patient level. She'll need to maintain a normal blood sugar, consistent carb diet, and compliance with medication. Towards discharge, TC has showed signs of improvement. Her mother has been more involved in her plan of care and has helped, that's helped out a lot. And she's also responsible for her plan of care as far as being court ordered to be placed in a facility where she has to take her medications. After frequent visits from the dietitian and helping her find foods that she likes, that has also helped her comply to her diet. She has been taught to counter carbs that are compatible with foods that she enjoys. She has also been able to understand what her blood sugar levels should be and what to do if they're too low or too high. Some days she has lacked the motivation, but has complied about 80% of the time, which is good compared to not complying at all. The nursing care management effectiveness at the system level. She'll have a safe place to live. She'll have the medications she needs, and she'll have regular doctor and psychiatric checkups. At the system level, she has had successful treatment, although she would not be able to comply to the plan of care if she wasn't conserved by her mother, and she is required to stay in the lockdown facility where she'll have a safe place to stay. If she didn't have that, she would be back living homeless on the streets. So I would say it has been effective for her at the system level. She is resourced by the courts to take her psychiatric medications, which has also helped her comply with other medications such as insulin. So the two are really important that they go together. When she is not on psychiatric medication, she isn't able to provide food and comply to medical care. So it's really important that she has that conservatorship that was placed by her mother. She'll also be given the choice to have frequent doctor visits at the facility that she's at. Okay, and here are my references.